of the important things about caring for patients is being able to care for yourself at the same time. This program helps you do that, and you have faculty that genuinely care about you as a person.
All of us care about each other. It's a very family feel to it.
It's an opportunity for you to have individualized support to get you where you want to go.
Those fellows get all of the faculty really focused on their careers, on their development.
The fellowship is structured much like many other programs in that the first year is clinical. Fellows have about 6.5 months of inpatient time. They learn how to become compassionate doctors and partners for their patients' care.
Part of the fellowship is getting you set up with mentors that are at various stages of their own career. Some of them will serve in the day-to-day, supporting you throughout your research projects and your clinical care, and then others are more like sponsors and will connect you with people around the country that have similar interests.
And so with that comes access to tremendous mentors and renowned investigators beyond those within the Department of Pediatrics, but also through Wilmot Cancer Institute.
I think this fellowship program is special because it really nurtures the development and growth of each fellow. And while our fellows work hard, they're also learning, and they also universally feel supported by their attendings, which is an important thing in a field that can cause grief at times.
One of the things I think that is pretty amazing about our faculty group is they really encourage and support us as fellows to be autonomous and care for patients and take full ownership of them.
I think that our program is very strong when it comes to providing our fellows with a very broad exposure to what you will generally see in pediatric hematology and oncology, because you're not overwhelmed by numbers, because we have a smaller faculty group that really nurtures and pushes for mentoring and patient exposure.
Our philosophy is to allow fellows to achieve their potential. If that means that they want to be more clinically focused, then we direct them towards experiences that support that clinical skill. If they want to be more research focused, then we introduce them to potential research mentors and really try to nurture that direction of training.
It is not a one-size-fits-all program. It is designed to support the individual goals of the trainee based on what their needs are at the time. And so I came in with a really open mind, and my advice to a new trainee coming in would be to do the same, because this program will find a way to fit your experience to what it is that you are interested in a really invested and devoted way.
Despite the size perhaps of our program, we are housed within a large medical center. So when it comes to research opportunities, be they clinical research, translational research, basic science research, or quality improvement research, I think that based on the track record of prior fellows, there is a lot that can be done. There's a lot of exciting initiatives, a lot of exciting research opportunities here.
We really invite applicants to come and explore all the different ways that we work with populations who are historically underserved. We also engage very closely with families so that there are opportunities to advocate for them on the institutional level, social level, and political level. So I really think of Rochester as a hidden gem. It's a moderate-sized city in upstate New York, but it has many, many layers of culture.
The cost of living, particularly as a person in training, is excellent.
You may be single, you may have a young family, you may have an older family. Rochester provides the ability to kind of meet any of those needs. We want to make sure that all of our fellows are clinically very well trained by the end of their fellowship, so that when they graduate from fellowship and become attendings, that not only do they know the basics of hematology oncology, they know how to manage the majority of hematology and oncology patients, but also that they understand that when they don't know, how do you figure it out? How do you ask the right questions? How do you identify the resources that you need?
Those resources are here, and taking advantage of them is the first in what I anticipate would be a long road of opportunities towards building the impact on pediatric hematology oncology care that you hope to have.